In 1620, while the Mayflower was in Provincetown, 18 of its men sailed in a small shallop, searching for a place to live. They came to present-day Eastham, where they were met by a group of Nauset. After a brief but violent encounter, the English left towards today's Plymouth. In 2020, we remember this first encounter. We explore its meanings for today and tomorrow.
Good evening. Welcome to our Sunset series. Tonight we're happy to have Jennifer Smith with us. Jennifer was served in the Eastham Fire Department full-time from 1982 to 2013, and she retired as a captain and as a paramedic. And she has been working for many years also in Honduras, which we're going to talk about both of those. So welcome, Jennifer, and tell us about your work in the fire department.
Thank you for the opportunity to be here, but also to talk about a couple of my passions. I'm very, very proud to have served the town of Eastham and Orleans for a combined 33 years. I'm also very grateful to the chief that hired me, Jack Austin, who was a progressive fire chief at the time and saw things in myself that I might not have seen. But as a woman back in 1982 to get on the job was not the easiest thing in the world. So I feel very blessed to have had the opportunity to serve the population in this town and to do a lot of community work with others and to raise my own family here.
I remember seeing the media coverage about 7 years ago of your retirement. A lot of people loved you and still love you very much, so we're very happy to have you with us. Now, maybe not as many people know this about you, that you've been interested in and helping in Honduras for quite a long time. What got you interested in working in Honduras?
We've been traveling down there 25, 26 years, our family. Initially, we started to donate in memory of my daughter, Chloe. She was born in 1992 after she had a very difficult pregnancy, but I had excellent health care, and I was hospitalized for a long time at Cape Cod Hospital and then transferred to Boston to a world-class NICU. So she had every opportunity as far as we could try. But when she didn't pull through, we decided to donate in her memory to a local organization doing good work in a developing country where there was no access to care and where mothers who lose infants have to just take it in stride and deal without having had the opportunity to try. So I felt very, very blessed, and so that was how we started.
And what year would that have been? You said 25 years or so?
Yeah, 1992 is
That's right,
when
you said
she was
died in
born, and so we started donating and supporting Cape Cares, and then several years later started to travel with Cape Cares teams. So all of our children, 5 children, have been down working with us, and that's had a tremendous impact on their lives. But we had a wonderful run volunteering with Cape Cares, and eventually got to the point that my husband and we decided that we wanted to work collaboratively with the communities, and we wanted to work with local resources, however threadbare they are. And we've been very gratified in that effort because we have a very committed team of Honduran doctors and dentists and many institutions and organizations that are working with us in Honduras.
So in that collaborative model, the name is Community Health Partnership in Honduras.
Yes.
And you're the executive director
Yeah.
in that. So whereabouts in Honduras? I've been to Honduras. I know it has several regions. And whereabouts in Honduras did you work or are you working?
With Cape Cares, they had several sites. We worked in Los Encinitos, which is about an hour and a half south of Tegucigalpa. And people there, it's a dry rainforest, and people mostly live on, it's mostly land grants that people live on. They don't have a long arc of community history. It's a very tough area to live on, to farm. But when we started scouting for a site that we could work in a collaborative model directly with the communities, friends of ours in Honduras helped us to do that and took us to Opatoro, which is a region in La Paz. And that's western Honduras. It's due west of Tegucigalpa, very close to the border of El Salvador. Mm-hmm. And the Lenca communities there have been there for many, many centuries. The leader of the Lenca tried to gather up over 200 tribes to try to fight off the the Spanish conquistadors. So there's a lot of rich history, but they maintain that. They maintain their ideals, their sense of community, of partnership. They were wonderful, the perfect partners for us to start with. So they're very committed to our work together.
So what is that work? Do you bring supplies down? Do you bring medications? What is your work, or what does your partnership do?
We work at every level. Each village has elected voluntarios. They're volunteers, advocates elected from their villages. And it may be one or two from a village, or even 3 or 4, depending on the size of the village. And then the link to them is the health promoters, who are linked to the rural clinics, who are linked to the regional clinics, who are associated with, they're semi-autonomous from the government. There are 4 regions that we work with. Some of our programs have reached into all 4, which is 156 villages over these sprawling mountainous regions. And so we focus on prevention, education, and we support any local efforts. We have natural plant remedy program as well. We're trying to flesh out all the experts in those areas. These are very rich geographical area for natural plants, the remedies. We bring about $500,000 in medications down every year that are hand carried by our team members, and those are almost all in-kind grants from a number of partners that we have. They have very qualified doctors who volunteer with us from Tegucigalpa, but they don't have any resources. The shelves are all threadbare, and people cannot afford to buy medications.
Before we're gonna have to have another segment and talk with you about the current conditions there now with COVID-19 and whatever. But in these years that you've been traveling there, what do you do? You go a couple of weeks at a time, a couple of months at a time? How do you?
I personally am there about 3 months of the year. Mm-hmm. I go 3 different times for 3 to 4 weeks. Mm-hmm. I travel with the brigades, but I arrive before and stay late, and then I go in the middle of our brigade times. Our brigades are comprised of U.S. We have some really terrific volunteers from the U.S., terrific doctors, but they usually our U.S. members make up about 50% of the team, sometimes less, like in the fall brigade. But I do a lot of the groundwork in outside of the brigades.
And do your children still go?
They're a little busy now. They're having families, but they did do extensive traveling and volunteering in a number of other countries besides Honduras. But when I'm down there, I work hand in hand with doctors and organizations and institutions. So all of my work is in partnership and collaborative. So we couldn't do much on our own, but together it's our motto actually. Together we can make a difference.
Well, it's wonderful that you morphed, or you had to leave one organization and found your own to be able to affect that community partnership. It sounds great that you did so. I myself brought a group of young people from Orleans and Eastham down there last summer, and it was shocking the level of poverty and unemployment and all of these things. So I have great admiration for you and others who are part of your brigades who do all this work. It happened for so many years. So thank you for viewing, and we'll be back with Jennifer another evening on another one of our Sunset series. Thank you.
Thank you, Tom.
My name is Joanna Hollick. I'd like to share an invitation with you regarding Eastham 400's other series, the Campfire Series. The Campfire Series is a series of hour-long presentations each Sunday in July and August that delve more deeply into some of the topics we discuss here on the Sunset series. We are happy to announce that our last campfire will be held in person. On Sunday, August 30th, the campfires will occur at the Eastham Windmill at 6 p.m. The same program that was presented on August 23rd will be shared again, featuring John Hanlon, who has led the campfire programs at the Cape Cod National Seashore for the past 20 years, and Linda Coombs of the Aquinnah Wampanoag tribe. Admission is free, but registration is required. Please sign up for these events using the form on eastham400.org. We are looking forward to these events and hope to see you there.